Well, hello and welcome to our third and final session of our baby weaning course. It's great to see you all again today. I am Melanie McGrice, a pre and postnatal dietitian, and I'd just love to thank Leo again for their sponsorship of this program and for putting it together. It's a really fantastic initiative. So today, in today's session, we're going to look at 4 key topics. The first one is bowel habits of little ones, and particularly constipation. Secondly, we're going to be talking about introducing allergens to your baby to prevent allergic reactions in the future. Then we're going to have a look at heavy metals, and then finally about whether or not you should be considering organic foods for your bub. So, as always, feel free to ask any questions, and yeah, let's get into it. So first of all, when it comes to constipation, the key reason why we're wanting to chat about this is because constipation is really common when we are when we start to introduce solids. And it makes sense because when you think about what we're doing is that we're starting to decrease the amount of liquid that is going into their little guts and have more solid foods. And that liquid food helps to make the bowel motions softer. And it's also got lots of key nutrients in that, like human milk oligosaccharides, which really help to make the bowel motions softer. So particularly when we start replacing some of that either breast milk or formula with more solid foods, that's when constipation is quite common in little ones. So I think the first thing is being clear on what constipation is and when to worry and when not to worry. I do find that some mums tend to worry a little bit too soon sometimes. Probably the biggest problem is that when mums are really worried about constipation for their babies, what can start happening is that mums will start cutting out all sorts of key nutrients, thinking that those core food groups could be the cause of the constipation, when often it's actually just the fact that the baby isn't getting enough fluid. So constipation is defined as stools being really hard, often dry, and we like to describe it like rabbit poo. So kind of like the size of baked beans. So when you get poo like that, it's really baked beany, instead of being a larger, softer motion. That's how you would describe constipation. Also, if there's blood present as well, that's going to be another indication of constipation. And if your baby's starting to refuse to feed because of the fact that they've got a sore tummy, that's obviously problematic as well. Like I said, it is common for constipation to occur when you start introducing solids, and particularly when you get to around 9 to 10 months, when you're starting to give your baby solids first and then do a top up with milk or formula. So they're starting to have less formula. That's when it becomes even more common. So the 2 big things to make sure is, first of all, is your baby getting enough fiber? And that's why it's so important to be starting with plenty of fruits and vegetables, because that's where your baby's going to be getting the most fiber from. So those plant-based foods are really the most important. So I would include grains in that as well. So little pieces of bread and pasta. Excuse me. They're really important for your baby in providing fiber, and the fiber helps to soak up and absorb that moisture to make a softer bowel motion. So the fiber is really, really important. And then secondly is making sure that your baby has adequate fluid. So that means that you're giving them a little drink of water with their meals. And I would recommend boiled water in the first year of life that has been then cooled down in a little sippy cup, and yes, they'll be fine to do that right from when you very start introducing solids. This is a really good habit to be getting your little one into, and they can also sip on it between meals as well, which is a good thing to do too. So yeah, that's going to be a really good habit. Now, if your baby is constipated, before going and starting to cut out core food groups, I would recommend, first of all, looking at their fibre and their fluid intake. Once you've done those two things and you think, right, yep, I'm sure that my baby's getting as much fibre as I can, given what, the amount of food that they're eating, and yes, they're having as much fluid as I can give him or her, then the next thing to be looking at would be, the next thing I usually recommend is a warm bath. So warm baths help to relax the muscles around the bowel, and so that can be great just to relax them and help them to open their bowels. The next thing to think about after that would probably be just a small amount of concentrated fruit juice. So we don't usually recommend fruit juice for little ones. We usually recommend either, obviously, breast milk or formula or water. But if they are truly constipated, then some fruit juice would be the next thing that I'd be looking at. You can dilute this in water as well, and that's probably where I would start with. You're literally just talking about a tiny amount, so about 50 mils is how much I would recommend starting with. And in terms of the types of juice, your best choice of juice will be a prune juice, and that's because prune juice contains a particular type of nutrient called sorbitol, which helps to relax which helps to relax your baby and helps them to evacuate those stools and have their little bowel motions. But pear and apple juice can also be really good choices when it comes to opening their bowels. Another strategy that you might like to use, particularly if it's an ongoing problem, is some probiotics. So you can get probiotics that are specific for constipation in babies, but usually it would be best to speak to your healthcare professional about this. And then if you're still having problems after trying all of those strategies, that's when I would look at things like a cow's milk protein allergy, but I would highly recommend speaking to a healthcare professional before just cutting out foods yourself. Usually it's diagnosed prior to kind of that 6-month stage, and so yeah, yes, it could be, but I would look at those other strategies first. Now, we have mentioned in the previous sessions about the importance of just being really strategic about how you bring allergens into your diet or into your baby's diet. So in an ideal world, what we want to do is make sure that your baby, when they're introducing solids, that they're not having any exposure to allergens, and that when you do expose your baby to allergens for the first time, that it's done so in a really controlled way. So what do I mean by controlled? Well, we want to make sure that we're introducing just one allergen at a time, so that then if your baby does have a reaction, you know what is causing that reaction. You want to make sure that your baby is really calm and peaceful, and that they're having that allergen in a non-stressful environment, so that again we can identify that it was the allergen and it wasn't the fact that your baby is sleep deprived or there's a lot going on for him or her at the moment. We also want to be making sure that that we're doing it at a time when you can get to a healthcare professional if need be. So if your baby is having some type of reaction, you don't want to be going, oh gosh, I don't want to be going out now because going to the doctors now because I've got a really important project at work today, or because I have to get to the doctors with my other child today, or something along those lines. So ideally, you choose your time that you are going to be introducing those allergens with a little bit of forethought. Now, in terms of what to look for an allergic reaction, it's important to note that that it can come up really quickly or slowly. So some allergens and allergic reactions actually don't show up for around 48 hours. So although they can come up straight away, some of them take a little while. And so just make sure that that window of time over the next 48 hours is relatively free, and that you could go and have a healthcare professional consultation if you needed to. Now, in terms of what to look for, so allergic reactions can also show up in with a few different symptoms. So these include things like itching and scratching, so being really itchy, being all red and hot, so flushing, getting hives, so that's when you get those little red bumps. And if you don't know what hives are, Google and you'll see a picture. Swelling, so particularly they might get swelling around their eyes or around their mouth, vomiting, excessive crying. Sometimes they can have real breathing difficulties as well. They can get really floppy, get really cold. So if any of those types of, and particularly if it's breathing difficulties or they're becoming floppy or vomiting, so those more severe reactions, that's when you want to just drop everything and go straight to the doctor, or call 000 and call an ambulance, because allergens can cause anaphylaxis, and not that we want to be scaring you, but that can lead to death, and so they will need an adrenaline injection for relief if they are having an anaphylactic attack. So you do need to get, like, if you're concerned, it's better to get onto it sooner rather than later. And when I say sooner, I mean immediately, because it can block the airways. So yeah, this is where you do want to just be careful if it's the first time for introducing these allergens. Now, saying that, the most common allergen to cause an anaphylactic attack is going to be peanuts, and so that's where it can often be good to introduce peanuts first, get that one out of the way, and then if they don't have a peanut anaphylactic reaction, then your likelihood of an anaphylactic reaction to the other types of allergens is lower still. So sometimes it can be just easier to get the worst over and done with, for, like, straight off the bat. So when it comes to our most common allergens, so there are 8 common allergens, and they are, I have to think, wheat, cow's milk, eggs, peanuts, and then other tree nuts. So other tree nuts, like your almonds and Brazil nuts, etc., they're a different allergen than what's in peanuts. So that's why we separate those ones out. Fish is another one, soy, seafood, I think that's the 8. And then the other one that has just been added to the list recently to make it 9 is sesame. So they're your key allergens. And so rather than leaving it to introducing them late, that used to be the old advice. And so now the advice is that we do want to be introducing them as soon as possible. So ideally, you're having them throughout pregnancy and breastfeeding to build up your baby's immune tolerance. And then when your baby starts solids, we want to get them consuming them themselves early on. Now, in terms of who is at highest risk, so if you or your partner, so baby's dad, has any type of atopic conditions, then that is going to put your baby at a higher, a significantly higher risk. So when I talk about atopic conditions, that's asthma, eczema, and allergies. And also if any siblings do as well. So if you have, for example, if the baby has a sibling that has peanut anaphylaxis, then this baby will have a 7 times greater likelihood of having an anaphylactic attack. So if your baby is in a high risk category, meaning that you or the baby's dad or a sibling has some type of atopia, then I would recommend just being extra cautious again. And what some parents do is that when they're giving particularly peanuts for the first time, in addition to those things that I was saying previously about making sure that your baby is happy and calm and it's a time when you can get to the doctors, some people will actually give those allergens, or at least one of the allergens, at least peanuts, at a doctor's clinic, or if not at a doctor's clinic, outside a doctor's clinic. So you don't necessarily have to make an appointment. You might just do it in a park outside of the local children's hospital, or near a doctor's surgery who you know is going to have access to the EpiPens that are going to be the adrenaline injections that are going to be able to open your baby's airway again. So with that, I was saying we want to be giving the allergens sooner rather than later. We also want to be, so right when you are getting onto introducing solids, I would encourage you to give those allergens sooner rather than later. And like I said, I often think that starting with peanuts is a really good recommendation, although saying that we don't want to actually give peanuts because that can be a choking hazard as well. So in a minute, well, actually, I may as well discuss it now. So what I would recommend instead of peanuts is actually a peanut paste, so like a peanut butter. Now, when you're introducing any of these types of allergens, you don't want to be putting it on the skin. You might hear that or read that in some blogs or what have you. You don't want to be doing that. You actually do want it on their tongue, in their mouth. So yeah, make sure. So if it's something like peanut butter, I just put a little bit on your finger and get them to suck it off is usually the best way. Yeah, and we're going to start with really small amounts and build up. So if you're doing peanut butter, for example, you don't want to be just doing it every day. So start day one, and then I would try again 48 hours later. So every kind of 2 days. And then you want to get into a routine whereby you're giving them each of these key allergens around about twice a week to build up that immune tolerance. So we start with a tiny amount. So with peanut butter, it's literally starting with around 1/4 teaspoon the first time, and then building up to 1/2 teaspoon, and then building up slowly until they're having a couple of tablespoons at a time. Or not that I have a couple of tablespoons, but maybe a couple of teaspoons. A couple of tablespoons is a lot for a little one. But yeah, until they're having kind of as large a quantity as they would have as part of a normal meal or snack. So obviously the older they get, the larger portion sizes they're going to be having. Now, one of the things that I think is important as well is, remember we were saying we don't want to be introducing any allergens until we're ready. And so that's fine when you're doing your own meal prep and what have you, when you're just giving your little one, chicken and veggies for dinner. But the difficulties starts when you start providing them with blended products, so packaged products, because not only can they have the exposure of the food, but you will have often seen, if you look at different labels and so forth, that like this product may be exposed to nuts, for example. It might say something, it might have traces of nuts or something along those lines. It might have a little warning label on it. And the reason is that where packaged foods are processed, they may have already packaged something with nuts in the same packaging plant. And so this is a risk for our little ones. And so this is where if you are providing your babies with any processed foods, where possible, it's great to be using those packaged foods that have been actually tested for allergies and allergens to make sure that they're free from those. Now, in Australia, we any labels around allergy-free or allergen-friendly are optional. That's not, like they don't have to. So it's listed under the company's discretion. And so, so this is where you do have to be careful and look for products that do have particularly when you're talking about baby products, I would be recommending looking for ones that are allergen friendly or allergen free until you feel confident that you've introduced all of those allergens to your baby. What else do I need to mention? So let's go through a few of these key allergens and how to provide them to your little one. So something else, sorry, that I didn't mention, which I wish that I had mentioned before, I was talking about babies who have high risk. Also, if your baby has any eczema, I would also put your baby under the high risk category. And so for them, I think that, you also just need to be that extra layer of careful, maybe doing those introductions to the allergens, again, particularly peanuts, either with a doctor or close to a medical centre. Now, so let's go through some of the allergens and talk about how to introduce them. So we talked about peanuts already. Tree nuts is very similar. So again, I wouldn't give your baby tree nuts because they're a choking hazard. So instead, I'd be recommending introducing tree nuts at around when you are introducing solids, so that kind of 4 to 6 month time frame. In a nut paste, so something like a cashew paste would be a really good option there. Eggs, so again, that 4 to 6 month time frame is ideal, but we have to make sure that the eggs are cooked because otherwise there's bacteria in the eggs that can be hazardous as well. So there, I'd be recommending things like some scrambled eggs, are usually going to be the best choice for little ones. So just scramble them up. Hard-boiled could be another option as well. And if you're going to hard-boil it, obviously then just cut it up for your little one as well. Now, cow's milk is an interesting one, which is often debated because the research shows that, again, it's best from an allergy perspective to be giving your little one cow's milk from around that 4 to 6 months, but then we don't want to be giving cow's milk at such a young age. Like the recommendation is usually not to give cow's milk to babies until after the age of 1 year. Now, the reason for after the 1 year is because toddlers and babies have a high risk of iron deficiency, and cow's milk can actually decrease the absorption of iron deficiency, making it even more like putting your baby even at higher risk of an iron deficiency. So for those reasons, we do want to be waiting till after the age of 1 to be giving your baby cow's milk in general. But what you can do is, and although we want to be giving them the cow's milk protein as early as possible, and we don't want to be mixing foods early on, when you do get to the stage of mixing foods for your baby, that's where I would be putting a little bit of cow's milk into that. So an example is with the egg, so with scrambled eggs. So once you feel confident that your baby can tolerate some scrambled egg as a meal, so again, you'd start off just with a half a teaspoon, maybe a half a teaspoon of like you're having some egg, and you just give your baby half a teaspoon and see how they go. Look out for any allergic reactions. If they're fine, there's no issues, then you build that up. And if it all is still going well, then the next step is to add some milk into that scrambled egg. And so that way you're not giving them a huge amount of milk, which is going to be decreasing their iron. They're still going to be having egg, which has got iron in it, but you're also giving them a little bit of that cow's milk protein to be able to test that and see how they are going from an allergic perspective. We talked about wheat as well. So when you think of wheat, usually we're talking about bread or pasta. So again, start small. So like just one of your pasta shells. If you're having some pasta for dinner one night, give them like just one of your little pieces of pasta, or cut off a little bit of your toast. I would recommend starting with toast prior to bread. Toast is easier for them to get down. Now, in terms of pasta and bread, obviously it's not really pureed. So this is where it comes back to, are you going to go down a baby-led weaning pathway? Are you going to go down a combination pathway, or are you going to go down a spoon-led weaning pathway? So obviously bread and pasta are more of that combination or baby-led weaning. So if you are going down the spoon-led weaning pathway, that's fine, just when you feel ready to give them a little bit of toast. But yeah, toast is usually easier in terms of a swallowing risk than bread is. So I'd give them toast prior to bread. Fish is another one. So fish is another really great nutritious food for them to eat. It's really soft for them to eat, so it's a great protein. And not only, so fish is a risk in terms of the fact that it's an allergen, but also the omega-3 in fish is really beneficial for little ones in terms of helping to reduce inflammation and to protect them from allergens in general. So you might want to start with the fish oil if you're going down particularly that spoon-led weaning pathway. But even if you're going to use a fish oil, you need to be really careful in terms of the allergen risk. So just watch them from that perspective. All right, so hopefully that gets you started in terms of allergens. I also then wanted to talk today about heavy metals. So heavy metals are metals like mercury, I'm sure you would have heard of, lead, arsenic as well, and cadmium. So there's some examples of heavy metals. And again, our babies, they're so tiny and their brains are developing so rapidly at this age. And so this is why these heavy metals are such an important consideration. And so obviously risks of ADHD, so attention deficit disorder, is certainly on the attention deficit and hyperactivity disorder has certainly been on the rise. Neurological disorders, autism, all of these conditions have been on the rise. And there is some emerging research to suggest that that might be linked to increased levels of heavy metals in our foods. And there was a really interesting big study that was done couple of years ago now, which found, it was called the Healthy Babies Bright Futures Study, and it looked at 168 baby foods. This was in America, and they found that 95% of products contained some type of heavy metal, which is really quite scary. And so over the last couple of years, the FDA, the Food and Drug Authority in America, have been putting out more and more rules around scrutiny around heavy metal in terms of baby foods in America. But Australia hasn't really caught up to this yet. So I would, given all of that, I really recommend that parents are looking in Australia, like look for, if you are going to use baby food products, look for products that have been tested for heavy metals, and use those brands where possible is really the safest thing to do. You also need to be careful of other baby foods in terms of things like teething biscuits and even infant cereals and things along those lines. So where possible, always using more natural foods. So instead of using teething biscuits, We use things like the little baby cucumbers and slices of apple or chilled banana, something along those lines can be good choices. Using instead of using rice cereals, if you can't find a rice cereal that has been tested for heavy metals, then use a infant porridge instead, or at least swap your baby over from a rice cereal to an infant porridge as soon as you can. Try to avoid things like those little baby rice puffs and those types of products, unless again they've been checked in terms of heavy metal exposure, and instead provide them with fresh fruit and veggies to snack on. It's going to be much better choices. And then the last question that I wanted to deal with today was about organic foods. So should you or shouldn't you be looking for organic foods when it comes to introducing solids? So I always like to recommend that it depends on what you and your family can afford, really, and what you can do. So yeah, like the primary goal is to make sure that your family are eating, including your little one, are eating a really nutritious diet. That's the number one priority. But second to that, if you can afford to provide your family with organic foods, particularly when you've got a little one in that first year of life, then I think it's a really great idea. And sometimes, particularly when you're using things like baby foods and baby products, sometimes the price is exactly the same to choose something, an organic brand, as opposed to a non-organic brand. And if that's the case, why wouldn't you just go for the organic brand? So there, again, we just have to remember that babies' brains are developing so rapidly at this age, and it's really setting them up for the future. So I think we really want to be doing everything that we can to help our babies' brains develop in the best way possible. So it is a really important time to be optimizing their nutrition and therefore optimizing their brain development. Alrighty, I might wrap it up there for today, but just to say that if you have got some additional questions, feel free to post in our Leo Facebook page. I'm always happy to answer your questions there, and so yeah, yell out anytime, and I'll see you all there. Have a good day. Bye for now.